A comprehensive analysis by researchers at UCLA and UC Berkeley found an expansion of Medi-Cal is a good deal for California. The report says that the state will incur relatively minimal cost as the federal government has promised to foot most of the bill. Gary Rotto, Director of Health Policy at the Council of Community Clinics, and Jorge Riquelme, Director of Bayside Community Center, are here to tell us more about the potential impact if this goes through. Gary, first tell us a little bit about this Medi-Cal expansion and how it relates to the Affordable Health Care Act.
Well, in the Affordable Care Act that Congress passed and then the President signed, it allowed for states, or called for states, to potentially be able to expand Medi-Cal coverage. Medicaid on the federal level, Medi-Cal on the state level in California. The Supreme Court in July ruled that that was constitutional and that states had the option, weren't compelled to, but had the option to expand their Medi-Cal or Medicaid coverage. And so that's where we are now. The legislature and the governor seem to be on the track and have been moving forward, but need to pass legislation in order to make that happen before the first of next year.
And they're going to talk about that in a special session that is coming up. Now, it's estimated 1.5 million Californians under age 65 would qualify for this new Medi-Cal program. What would that look like here in San Diego in terms of people that would be seen?
Well, the first thing to recognize is that for the first few years, that expansion will be paid for 100% with federal funds. It's a sweet deal for California. And that expansion will look like people coming in, maybe some people that are already coming to clinics as people that have not been able to afford anything, but coming in on our sliding fee scale, or maybe many new people that haven't had coverage before and now want to be taken care of in the clinics.
I believe I read, Jorge, about 120,000 in the next 6 years are expected to participate in this if it goes through. What concerns do you have about this expansion that it might not be so great?
Well, first of all, we're very excited about the expansion, but we just want to make sure that there's adequate level of resources so that we may enroll those most vulnerable, the limited English proficient populations, the impoverished populations, and the immigrant population, and particularly with issues concerning their legal status.
And let's talk about undocumented children, because they are not part of this transition, correct?
That's correct, and there's also concern that an unintended consequence of pulling out funding from hospitals may deny some access to care that they have at the present time. So in light of that, the community clinics are going to play a vital role in support of this population.
Because they can still go there, as we were speaking about, on a sliding scale, regardless of their insurance.
Anybody that presents themselves, we will take care of one way or another.
All right, and let me ask you this, Gary, as far as in the long run, do you think that this expansion would be a good thing for health and for the people here in San Diego?
Very much so. The UCLA study showed that that the Medi-Cal program, if somebody's covered with Medi-Cal, it's going to reduce mortality rate and rates of disease. We're able to, when people are part of Medi-Cal and they're coming in and they're having a primary care home, we're able to take care of a chronic condition before it becomes full-blown. Reach somebody before they become diabetic. Maybe they have pre-diabetes and be able to work with them. Asthmatics, hypertension.
Right, certainly lots of research shows that early intervention in medical situations usually improves. Jorge, is there anything else that your particular clinic or anything else that you feel that this expansion, which won't happen until 2014 if it gets passed, that people need to be concerned about, especially when it comes to seeing their same doctors? Or will they be able to see their same doctors?
Well, that's where community-based organizations make a big difference. Community clinics or community centers as ours, so that we can help people in the process on the bureaucratic morass that they're going to be facing. There's a lot of misinformation, so we need to be sensitive to the needs of this population and aid them making sure that they have access to this expansion of these programs at this time.
All right, and will the clinics be able to help people sign up for the new Medi-Cal program?
Yes, no question about it. We have patient assisters, folks that are very experienced in the process and being able to walk people through, be able to check their eligibility and to get them, whether it's on Medi-Cal or in some type of program. We want them to be covered. We want them to have a medical home. Yeah,
well, we should find out more about that. Sacramento lawmakers are expected, as we said, to have this debate over the expansion and a special session later this week. So thank you both so much for talking with us.
Thank you, Peggy.